Welcome to the Side Ventures series by SonyDocs. Welcome to another episode of Side Ventures. This is Donna Coriel. I am the founder of SonyDocs, and beside me, virtually, is sitting Dr. Delia Chiaramonte. Dr. Chiaramonte, I want you to introduce yourself because you're probably going to do a much better job than me.
Absolutely. Thanks so much for having me. So I am an integrative palliative medicine physician. So I started life as a family doctor way back when. And the reason I transitioned to integrative medicine is that when I was doing family medicine, I found that there was this group of people who had all of these complaints, felt terrible, but I couldn't find anything wrong. Mostly women, often the age I am now, and they just were tired and their head hurt and their chest hurt and they couldn't sleep and they felt awful and all the thyroid was fine and their blood count was fine. They didn't have cancer. And what I found was when I started treating them in a whole human way, using not just medicines, but also how's your sleep and how's it going with your husband and what's important to you in your life and do you move and how do you eat? When we approached it from that point of view, they got better. And then they sent their friends and then their friends got better. And that opened this whole concept to me of what is this? Because I didn't learn this in medical school. Turns out that was integrative medicine. And so fast forward a while, I ended up as the associate director of the Center for Integrative Medicine at the University of Maryland for about 10 years and did really wonderful, interesting things there, teaching medical students about integrative medicine. And we had an inpatient integrative medicine service. And then one of my children had an accident and fell off a horse onto her head and had a really challenging recovery. And I learned a whole lot about pain and suffering and the connection of physical and emotional suffering and what that does to the caregiver, me and my husband and my other child. And long story short, I ended up in this other direction, which was palliative care. And what I found in palliative care was that the people often that I cared for there were in some ways happier than some of those family medicine patients I had taken care of because they were facing this difficult reality of the end of their life. And so they totally reshuffled how they lived their life. So they got rid of all the people they didn't like and the things they didn't like, and they made a life that they liked. And then despite their illness, they felt happier. And so what I ended up with, because I was so struck by that idea and the integrative medicine idea, was this combination of integrative palliative care. And so I started a program, inpatient and outpatient integrative palliative care program, which I did for almost 5 years. And in that time, I learned so much about caregiving and what it's like for the caregiver, but also what it's like for the physicians. And so since then, I have moved to wanting to spread the word. I didn't want to be just like little me and our tiny little team doing integrative palliative care that nobody really talks about. So I started the Integrative Palliative Institute. I started a podcast, the Integrative Palliative Podcast, and now I teach physicians how to take care of seriously ill people without losing themselves. So bringing their whole heart to it, but also protecting their own well-being. And also, it turns out that many people who come to me want to learn these things because their own family members are ill or aging. And a lot of the tools that we use for patients, we can use for ourselves and our family as well.
So this is great. Obviously, the title of the series is called Side Ventures. I want to note here that you, as a healthcare professional, mainly we have many, many physician followers and listeners. You, as a healthcare professional, can go about it different ways. Your target audience of your side venture can be patients, and your target audience of your side venture can be physicians. It it
Yep.
it matters, of course. It matters for you to really define your target avatar in identifying who am I actually teaching? Am I spending time in my side venture educating patients, or am I spending time on my side venture just passing it on and sort of educating doctors so that they can then pass it on to patients?
Yeah.
I think
I,
that's
I love
important.
I love this topic because I struggled with it so much in the very beginning because I didn't want to cut out anybody. And I did through this institute want to help family members and family patients who are going through difficult illness, but I really wanted to teach physicians and other clinicians too. But then also hospices were coming to me and saying, "Oh, you did an integrative palliative thing. Can you teach us to do that?" And so I went back and forth. I really struggled. I met with mentors, like, what should I do? And how can I have one statement on my website that includes all those people? I really struggled back, changed my website over and over and over. And ultimately, what I landed on with guidance, I like now, which is when you come to the homepage of my website, there's right away 3 paths. If you're a clinician, click here. That takes you to the clinician path. If you're a hospice or organization, click here. If you are a family member of someone with a serious illness, click here. And so it allows me to speak to different audiences, and I can give different things to different people. So on the patient family path, there's a smaller thing that they can purchase. I'm not putting a ton of energy working one-on-one or even in group coaching with those families, that population, but there's something for them there. For hospices who want to have an integrative approach, there's a consultation option, but that's not all that I do. The place I'm really putting my heart is in educating physicians and clinicians. But because I have those 3 pathways, I can do them separately. And that really solved a problem for me.
What I really also like about what you're building is that you are focusing on building a brand, right? You're focusing on building the brand that your company represents, but within it are different resources that can actually, in and of themselves, be represented as side ventures.
Yeah.
Namely, I'm speaking about you as a course creator. You've recently created a course that we are going to actually be building a page for
Yep.
in our courses directory on SomiDoc. So look out for that, everyone.
Okay.
You're a speaker, right? Not everybody
Yep.
gives their speaking ability. So you are going to speak for our pain conference that's going to be
Mhm.
coming up virtually.
Indeed.
Um, and I believe you have a podcast too, don't you?
I do. I have a podcast, the Integrative Palliative podcast. We have 130 some episodes now. It's weekly for a couple of years, and it is fantastic in for a couple ways for me. First of all, it is fun to share what you know. I get a ton of really positive feedback. People I do not know who just contact me on LinkedIn and say, "Oh my gosh, I listened to your podcast and it was so helpful for this." And often, even though I'm speaking to physicians in this podcast, people will say, "Oh, my mom was sick, and I listened to the one about how to talk about hospice, or when she didn't want to take her opiates, what we talked about that." So people are using it partly in their work and then partly for their life. And the people who have purchased my course, a fair amount of them, I'll say, "Hey, and I have this podcast," and they'll say, "Oh, we know, we listen already." So I think people are coming to me through the podcast as well.
Yeah, I can totally relate to that. That was a struggle that SomiDocs had for so many years and continues somewhat to struggle with is that the website is public, just like your podcast is. And in it, for example, we have a magazine, we have series, we have conferences, and
Yeah.
many of them are meant for physicians, but the general public really does find interest in reading our articles and attending our conferences because of
Yeah.
the day and age that it is. And we're really all about empowerment. And especially with Dr. Google at play, right?
Right.
The world is recognizing that they really do need to vet their sources. So when they come into a website like SomiDocs, where everyone is vetted as a medical doctor, at this instance at least,
Yep.
they know that they're getting their information from the right source, right? So in the old days, it used to be that the doctors would go to the conference, soak everything up and learn, and then those doctors would individually teach the patients in the clinics.
Right.
And that seemed to be, it worked great, but it was a longer process. Whereas nowadays, that's still in existence, but the patients can additionally attend these conferences because they're virtual, because they're free while they're live, and sort of learn firsthand.
Yeah. And I think they figure if someone's teaching physicians this must be good information. Maybe I can get something out of it too.
Absolutely. And so check that out if you're listening. It's at doctorsonsocialmedia.com/conferences. We don't yet have a date at the time of this recording, but I'm sure after we publish this, there hopefully will be a date on that. But it's coming up in soon. And even if you're listening to this and it's already happened live, the really beautiful part is that you can go back to it and you can actually purchase, access to it, and have prolonged access for 6 months to take your time watching. So tell us about, like, did you struggle building your brand up?
Yeah, sure. This was news to me. I didn't even identify with the word entrepreneur at all. I don't have business people in my family. This was not a concept that I really understood, but I just felt this calling to share this message. And in order to do that, you have to become an entrepreneur. So uh, I I read a lot of books. I got some coaching. I tried things and I looked for the feedback, what came back, what seemed to resonate with people, what didn't seem to resonate with people. I have learned that what you put out there is slow, but it's a slow burn, but it grows. So I learned to be patient. In the very beginning, you think, oh, I'll start a podcast and all these people will show up at my door. But of course, in the beginning, no one knows who you are. You just have to keep making connections. And I think that's probably one of the biggest things that I learned is that real, authentic, honest connections are number one, cool and fun and nice, and they make your life better. And also on the side, they start to build your business. And that's one of the nice things I found about having a podcast, actually, is that mostly it's me. 3 of the 4 is just me, but once a month or so, I interview somebody. And so when I meet somebody, either in person or through someone, or I read a book or on LinkedIn, and they are interesting and I feel like they might contribute to my audience, I invite them. So it's a great thing to offer. It's like a gift to them. Most people want more exposure. And so now I've talked to somebody for, half hour, 45 minutes. Now we have a connection. And so maybe something later comes up, or they tell somebody, or their mom gets sick and they buy my book or something. And it just grows in a really organic and nice way.
That's beautiful. I think there's going to be many opportunities for facilitated collaborations of this sort when I
Right.
finish creating the lineup for that pain conference. So I'm very excited
Right.
for that. Um, I wanted to just, first of all, say to you that I'm so sorry about the share that you just
Thank you.
so kindly shared with us about your child. Are they okay, is my question.
Yeah, it was a terrible 3 years. And whew, boy, is it not fun to be on that side of the medical system. Um, the hard part about having someone that you love be ill or injured in that way is you don't know the end of the story. So, had we known that she was ultimately going to be okay, and she's graduated from college recently, she's in graduate school now. Hallelujah, it's wonderful. Yay. Um, but I have something else interesting to share about that. So, had we known that it was going to be okay, maybe it wouldn't have been as tragic feeling, but boy, you just don't know. And she was 12 at the time. And boy, when it's your child, right? But here's the thing. This is one of the most powerful things we did by accident. I didn't even know this was a thing. But what we said early on, when basically she couldn't go to school, she couldn't read anymore, she had to be homeschooled. She was in constant, terrible, awful pain and had all kinds of other neurologic things. So she couldn't do much. Her life was pretty, and all her people disappeared. Like, when you're 12 and you're a bummer, your friends all disappear, right? So she had basically no connection to her sense of self anymore. But we asked her this question. I asked her this question. I said, I wonder what this will mean for you, this experience. This is the most intense experience of your life, right? Your 12-year-old life. Don't answer it now. Let's just make space for this question. I wonder what this will mean for you. It will mean something because it's so intense. It could mean something negative, could have been very negative, or not. Maybe you'll be a healer, maybe you'll be a doctor, maybe who knows what will happen. But let's just like hold a container for I wonder what this will mean for you. And oh, I might cry.
We'll be right back. Take a listen to snippets from our recent obesity medicine conference, which you can now access.
So what is BMI? BMI is just a formula. It's nothing magical. It's a calculation of the weight over height squared, and you come up with this number.
So just to go through it with you all, obviously unprocessed foods are things that are as close to nature as possible. So the apple that you take from the tree, it can be the potato that you take from the ground.
From the age of 25 to the age of 65, you're already losing muscle mass, right? So we have to do a lot of things to make sure that we don't see that loss of muscle mass.
When I see kids who are struggling with their weight and having complications such as elevated liver enzymes, breathing problems, multiple different complications from their weight, they're not as free as they could be.
When you fight sleep, you will lose 100% of the time. Your day-to-day functioning is compromised for one thing, but you also lose with long-term diseases associated with insufficient sleep or sleep disorders.
Let's talk about the neuroscience behind obesity. So the brain plays a larger role in weight gain and weight loss than I feel in general people give it credit to. And this is just kind of everybody. It was me too.
Fast food is everywhere in American society. It's available all the time, 24/7, and it's usually a lot cheaper than healthier options.
So now I'm going to dig a little bit more into teaching kitchens and culinary medicine. So what are the benefits and the purposes of these interventions?
Genomics has been now available for a long time, and more we have it available even for patients without the prescription of doctors. And you will see that in the market, we have many companies using this.
So there are a lot of new technologies in care settings that have become part of obesity care. We have telehealth. Many online programs offer weight loss services. There are many that provide obesity care specifically.
So again, we're thinking about obesity as a chronic disease, and we need to think of it as the same way we would with diabetes or cholesterol or depression, where patients are likely going to need these medications long term. Just because the symptom went away doesn't mean the treatment that we were using should go away.
So what's membership? So membership model is, for example, I open up a panel, say I'll accept 100 patients, and I tell each patient that you will be paying me $200 a month.
Let's get back to the show.
But let's just hold a container for, I wonder what this will mean for you. And, I might cry. She came back to me 2 years later. So things were getting better by then. She came back and she said, I know the answer. And I didn't even know what she was talking about. To what? Answer to what? She said, that thing, that question, that thing you said, what will it mean for me? I know the answer. And what she said was, I found a strength in myself that I never thought I would have. And I wouldn't have gotten here had I not gone through that. So previously she had been kind of a very introverted, shy, kitty cat t-shirt kind of person. And in this process of getting her life back, fighting back, she had a mohawk, she learned to shoot a gun, she learned archery, she just found power to get herself out of this terrible hole. She developed this whole amazing ability in sign language. She had trouble with auditory processing, so she learned sign language. And now that is her career, actually. She has a whole career around now. She's fluent in sign language. She works with deaf people, and she's building a whole career around this that I don't think would have happened without this experience. And so that concept, that not the toxic positivity way, yay, it happened, but more, this is a thing and it's hard, but I wonder what will come from it. I wonder what I always say to patients is what flowers we can find in this poop. There's poop, there's a lot of poop in life, but also there's flowers. And so what can come from a difficult experience? And I think that concept was so powerful for her, for sure, but also for me. And then also for every patient, I think, that I've talked to, I have shared that idea and it resonates. And also for physicians who are practicing in a really difficult environment right now. And, even the program that I had started through COVID, the hospital had money issues and the program was shut down, which feels like a lot of poop, right? Oh, that's so terrible. It was this wonderful thing. But then it opened this space for me to start the Institute, to have the podcast. I wrote a book, to start to teach clinicians, physicians. I wouldn't have had time to do any of these things if I was working full-time at, inpatient palliative care. So with every difficult thing, the poop, if we look, there are flowers. And I think that perspective gets you through life in a much happier way. It helps you with a business when you're struggling and you're learning, you know, you made a mistake, but what did you learn? What can happen better next time? It's just a way of carrying yourself through life that I think makes it better.
Oh, so beautiful. Such a beautiful share. Two cliche statements come up that are certainly overused. One is that she made lemonade out of her lemons. That's for sure.
Yep.
Another statement that is probably overused, but comes up again and again, and I just personally love, is that what doesn't kill you makes you stronger.
Yeah, no, and that's true. Yeah.
Yeah.
That was exactly her experience. Exactly. And I think the fact that we have all these different ways of speaking about this similar concept shows how important it is. And the only caution or caveat is that while gratitude and finding meaning in difficult experience is a positive thing, toxic positivity is not a positive thing. And that is like, let's whitewash over the smelly mold, you know, that if we say, well, it's great that that happened. You know, no, it's not. Like if you have
Right.
cancer, it's not
Interesting.
great, right? You get fired from your job, it's not great.
Right.
It doesn't mean you can't find the flowers in that poop or make lemonade from those lemons, but to just say, oh, it's all good, makes us stuff the negative feelings, and that's
Right.
not healthy at all. So we just want to make space for both. Yeah, that sucked. And here's what I learned. Here's a person I met. Here's a new opportunity that I created for myself, etc.
I've never heard of that term, and you defined it now. I was going to ask you what it means, but you've told us. Toxic positivity. Is that a known term?
It is.
Okay.
It's a known term, and it's important. I think anytime you feel the urge to talk about gratitude, you have to check yourself and make sure that what you're not doing is spewing toxic positivity on someone else, right? So if you tell your friend, oh gosh, you know, I got diagnosed with stage 3 breast cancer, you do not want the first thing out of their mouth to be like, well, at least it's not stage 4, right? That's not what you want. You want them to say, oh, that sucks, man, I'm sorry that happened, crap, like, how can I support you? What can we do here? And then over time, will you grow in some way from that experience? Sure. But the first thing you hear should not be how great it is that you just got diagnosed with stage 3 cancer. That's toxic positivity.
Got it. That makes a lot of sense. It's interesting. We have needs as humans, and that just doesn't necessarily meet that need when we're in that state of vulnerability where we're sharing with someone that we just got, you know, something really shitty handed to us, and then someone is like celebrating it. Right.
Right. How great that it's not pancreatic cancer.
Right. Like
okay, but
they're
help
probably
me.
right. And a lot of times they're probably trying to come at it from a positive place, from saying, look at the bright side, almost like look at the glass half full, where you're really not ready at that moment to look at the glass half full. You want them to look at your half empty glass.
Exactly. And I think, you know, in palliative care, it comes up so much because everyone that we deal with is dealing with something tough, but it comes up also with anybody who's doing hospital medicine or even outpatient medicine, because some of your patients get difficult stuff.
Right.
And so it comes up a lot that we don't want to encourage people to get stuck in, this is the worst thing ever and I'll never be happy again. We don't want to go like, yeah, you're right, this is the worst thing, you'll never be happy again, you're right. That's not good. But also trying to whitewash it and force them to stuff their feelings is equally not good. And we make that mistake even as clinicians, because if you do that, you just shut the person down. So, you know, if they say like, well, you know, what if the chemo doesn't work? And you say, oh, don't talk that way, be positive. What message did you give that person? You gave them the message, we don't talk about that here.
Right.
Those fears that you have are not welcome in this space. And so you just deal with that all by yourself. And that's, of course, we don't mean to do that. We don't want to do that. But it is so hurtful when we negate people's negative or fearful feelings and we really make it clear that you're all alone with that because I don't want to deal with it. And so a more loving space is, you know, that is so hard. Tell me how I can be of support to you. I'm sorry you're going through that. Knowing in your head, I know they will find some meaning out of this at some point, but you just can't lead with that. So having kind of the subtlety of allowing them their feelings, and then when it feels right, opening up space for something else. And I have actually a trick that I use myself all the time that I've taught to patients forever, which is that, and physicians, which is this.
We'll be right back. Listen to our experts in our latest conference on gut health.
I'm going to be speaking about osteopathy and its applications for gut health.
One of the biggest links in our treatment plans is missing, and that is gut-brain axis and how they are regulated by the vagus nerve.
I would like to tell you more about the importance of hormones on gut health, on digestion, gut absorption, and the gut microbiome.
I look at it like a top-down, bottom-up approach. How we think and feel can affect our gut function, and our imbalanced gut can affect how we think and feel.
I believe the gut holds the key to the majority of chronic medical problems. My goal is to educate and empower people to understand the gut microbiome so that they can also optimize their health to live a happier and healthier life, both physically and mentally.
Gut flora, probiotics, prebiotics, are those real? Do they really help? Are they important? Yes, these are some of the questions that we will be able to answer during our talk.
I'm very excited to be talking to you about one of my favorite topics, irritable bowel syndrome, or IBS. We'll be tackling IBS from all angles, from its epidemiology, pathophysiology, and then spending the bulk of our time examining the literature on the treatment of IBS, particularly in the non-pharmacologic realm.
We're going to speak a little bit about how the gut-skin axis interacts to contribute to certain diseases such as acne, hidradenitis suppurativa, atopic dermatitis, and psoriasis.
I look forward to talking with all of you about heartburn, reflux, some of the causes of reflux and heartburn, and all the new exciting things that are available now that we can do to help you feel better.
I focus on 6 pillars of wellness, which includes mindset, stress management, sleep, nutrition, movement, and detoxification.
The topic is how we can overcome challenges malnutrition-wise or obesity reduction by personalizing nutrition for every patient that we see, as opposed to giving them exercise or nutrition prescription that is very general, which may not work for all.
Soak it all up virtually, either live or at your own pace through recordings, exclusively through SomiDocs, the healthcare innovation hub that's looking to make things simpler. Now back to our show.
I have actually a trick that I use myself all the time that I've taught to patients forever, which is that, and physicians, which is this. I don't like blank, but at least blank. This is a way to practice this idea of holding space for the poop and the flowers. So I don't like that I have cancer, but at least I have great doctors. Or I don't like that I have to get chemo, but at least I already have short hair, so it won't be that, big a change. Or it doesn't even have to be related. I don't like that I lost my job, but at least my dog is so adorable, right? I don't like that I missed that meeting, but at least the sandwich I had for lunch was amazing. And what it trains us to do is make space for both the darker part and the lighter part, right? The poop and the flowers, the lemons and the lemonade. So it's a really great psychological trick. And you do it anytime you are whining. If you're like, oh, I can't believe that happened. But at least, and just pick something, at least I have air conditioning, at least I'm not starving. At least my hair looks good today. Like whatever, it doesn't matter. It's just the idea that you allow yourself the negative and then you make a little space for something positive.
That's great. That's definitely a great tip. And I think that if anybody is listening and this resonates with them specifically, you can certainly check out the course, the conference. And that's what I sort of wanted to go into as well. Especially since, we're hoping to focus also on side venturing in general. Is this what you built the course around?
Yeah, the course for physicians is called Joyful Palliative Care, but it's not just palliative care doctors or clinicians. It's anybody who takes care of seriously ill people. And the concept there is learning to bring your whole self to take care of patients and also keep yourself from getting depleted. Because the healthcare system, as we know, is so tough right now. And a lot of physicians are unhappy as maybe being kind, right? Miserable, depleted. How did this happen to me? This is not what I thought it was going to be like. And so how can you learn to bring your whole self to your clinical care, but then also take care of yourself? So, because what I have seen people do when they get really burnt out is they kind of shut down, they like go through the motions, and now they're not bringing their healing presence in the same way to the patients, and then it's less satisfying, because that's the only part that's satisfying. Like Epic's not satisfying. It's the connections with people, and when they tell you how much they help, that's what fills us back up again. So, but also people who just are a sponge, take everything from me, I'm going to spend every minute with you, and have no boundaries, get painfully depleted and then can't do it anymore. And so how do you manage both of those things? And part of it is using this integrative palliative care approach. So that is integrative symptom management. There are not just medicines to treat symptoms. There are all of these evidence-supported complementary modalities that really do work. We can use them for patients, we can use them for ourselves, we can use them for our own sick loved ones. So there's this whole knowledge base out there that pretty much people aren't using for seriously ill people, that make the work more satisfying and that make us happier people. So that is what I teach clinicians.
Let's talk about the course itself, just kind of the nitty gritty of it for those physicians that are listening and maybe want to build a course on their own. Sure. Did you build it using, like, how did you, is it video based?
Yeah, so I've run it a couple times, and it was a combination of videos and Zoom calls. So I had to learn this from the beginning. I didn't know how to do any of these things. There are lots of platforms where you can house the course. I use something called Kajabi, but there are others. And one of the great things about putting it on Kajabi is that and other platforms too, is that you can put a lot of your stuff there. So if I offer a free guide, which I have, so I have free guides for clinicians who want to have this idea of giving more to their patients, but also caring for them. I have also a free guide for physicians and clinicians who have a sick loved one themselves, like a mother who's aging, has Alzheimer's, etc. So those are free. People are welcome to them. But in exchange, they give me their email, which gives me the opportunity. If they stay with me, they're welcome to unsubscribe anytime. But if they want to hear what I have to say, it helps me make a community so that I can let them know, hey, here's information for you. Here's my podcast. Hey, my book came out. Here's a new article that came up in the field. So it kind of allows us to gather together. And then when I have something that they can purchase, like this course, it allows me to tell them directly about that. So the course is both video. There's a large integrative symptom management. It's over about 20 hours of really evidence-supported complementary modalities for pain and nausea and fatigue and constipation and all the things that seriously ill people get. So what's the evidence for acupuncture? What's the evidence for meditation? How do you do it? How do you talk to a family or patient about guided imagery? What is manual medicine? Who should you pick? How do you know a clinician that you're sending to is good? All of those, like, how do I put this into my practice in real life in an evidence-supported way? So that's a bonus that people get. And then the primary course is 6 modules of about 2 hours each, cut in smaller pieces. And then there's a longitudinal part where twice a month we meet on Zoom. And so one of those is an experiential learning thing. So let's practice EFT or tapping. Let's practice guided imagery together. Let's work on our values and, you know, what we want to have happen in our life, that kind of thing. And then the other one, every other week we meet, is a case discussion. So in real life, like, you have this patient who isn't getting better on their medicines or won't take it or is so depressed or their family's a mess. How do you actually handle this in a whole person integrative way? And question and answer. And then a community where we can support each other.
Wonderful. And that just gives a lay of the land for those of you that are listening that want an example of how somebody not only builds their brand, but then creates resources from that brand, including what Dr. Chiaramonte did, which is building a course that kind of works on its own, except it sounds like has some active components to it where she's also meeting with attendees or customers, her target audience, and is spending time with them actively as well on a one-on-one.
Yeah,
so
if they want, and that I think is something that I learned in the beginning. We talked about what, you know, was it a struggle? Yeah, in the beginning I thought, oh, I'll just give all these things and everyone will show up and everyone will watch all the things. And of course they don't, because they're busy. And when I look at my own behavior, I buy things and then don't watch it for months. So what I discovered is different people are different. Some people really want to see you and talk to you and get their questions answered. So there's an option for that. Some people don't want to do that. So those question and answer sessions are recorded And so somebody could never meet me and get all the same information if that works better for their schedule, whereas there's an option for people who want touch. And so that was one of the things that I had to learn was different people want different things. And sometimes you might choose, well, I'm only doing it one way or only doing it the other. But for me, it worked to say, well, if you're super busy and don't want to meet in person, you can do it this way. If you do want to meet in person, you can do it this way.
Wonderful. And that really is some food for thought for those who are listening, who are contemplating doing things on their own. I was just commenting on another episode that I was thinking of building a series where I just kind of spoke to the camera, spoke to the video, spoke to the podcast in audio about the different concepts of branding and how you can build things and kind of speak on the things that we really, really lightly touched on here. So
that would be great.
Yeah. And
I would have listened to that if that were there.
I think I need, right. I think I need to do that. So that this is, again, Delia Chiaramonte. She is going to be one of the speakers in our upcoming pain conference. Do you remember what the lecture topic is? I don't know off the top of my head.
I think integrative symptom management is what we had talked about.
So
evidence-supported integrative symptom management.
Wonderful. And if you're listening to this and this sounds like it's up your alley and you want to hear more of Dr. Chiaramonte speak about her specialty specifically, you can certainly do that. Our conferences are free while they're live still. And so you can certainly click on register doctorsonsocialmedia.com/conferences. Also make sure to check out her course and actually see what it's about, maybe take it. And thank you for joining us, for sharing so many vulnerable moments from your own life and some of what went through building your own venture.
Thank you so much for having me. I really appreciate it.
Of course.
Thanks so much for listening.